Hi, my name is Fernanda Castillo, and for this video, I'm going to be talking about the willow bark. And first, I'm going to explain to you what this is. Willow bark is a supplement derived from several varieties of willow tree, including white, black, crack, and purple willow. Willow bark contains a chemical called salicin, which is similar to aspirin. It has pain and fever-reducing effects in the body. The use of it dates to the time of Hippocrates when people were advised to chew on the bark to reduce fever and inflammation. Willow bark has been used throughout the centuries in China and Europe and continues to be used today for back pain, osteoarthritis, fever, flu, muscle pain, and many other conditions. The bark of white willow contains salicin, which is a chemical similar to aspirin. In fact, in 1800, salicin was used to develop aspirin. White willow appears to bring pain relief more slowly than aspirin, but its effects may last longer. There have been some studies to determine the effectiveness of it, but it varies depending on the use you make to it. A small number of clinical studies have been conducted that support the use of willow bark extracts in chronic lower back and joint pain and osteoarthritis. One confirmatory and exploratory studies indicate a dose-dependent analgesic effect not inferior to rofecoxib in patients with low back pain. The review provides moderate evidence of effectiveness for the use of ethanolic willow bark extract in low back pain. Further studies are required to find out if treatment of osteoarthritis and rheumatoid arthritis requires extract with higher doses of 200 milligrams of salicin per day. On the other side, in recent years, various in vitro and animal studies have demonstrated that the inflammatory activity of willow bark extract is associated with regulation of the inflammatory mediators, tumor necrosis. There is interest in using willow bark for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. Despite all of the studies that have been made, children under the age of 18 should not take willow bark because of the danger of developing Reye syndrome. As mentioned before, aspirin was developed by using salicin, so nowadays it can be taken and integrated in conventional medicine by taking willow bark along with aspirin, and it might increase the effect and side effects of aspirin, making it stronger. Willow bark can be used as an alternative of aspirin, especially for those who suffer chronic headache or back pain. Moreover, it can be implemented in the therapeutic side because it is demonstrated to have relaxing effects when taken in this. By this, we can implement the use of willow bark in the conventional medicine. Thank you.